Complications of low heart rate and high heart rate. A heart rate that is consistently outside of the ideal ranges can lead to complications. Low heart rate. Without appropriate treatment, a low heart rate can cause dizziness, fatigue, confusion, fainting. Over time, both high and low heart rates may damage the heart. Having a very low heart rate can also damage other organs. This is more commonly linked to low blood pressure or other signs of shock. High heart rate. Without proper treatment, a very high heart rate can lead to stroke, heart damage, organ failure, cardiac arrest, feeling dizzy or faint, chest pain. Underlying conditions. For most people, having a heart rate that is consistently too high or too low may signal an underlying condition such as damage to the heart's valves or electrical system, heart disease, chronic or systemic infections, issues with the thyroid, anxiety disorder, congestive heart failure, anemia. When to contact a doctor? It is not an emergency if the heart rate briefly falls outside the recommended range or if a person's heart rate shifts and improves with relaxation or deep breathing. However, a person should contact a doctor if they notice that their resting heart rate suddenly changes, having a change in heart rate that causes anxiety, experience a heart rate change after taking a new medication, often have an irregular heart rate. A person should go to the emergency room if they have shortness of breath and a change in heart rate, feel very dizzy, faint, lightheaded or confused, have chest pain and a high or low heart rate, have an infection and a low heart rate, are bleeding and have a low heart rate, which may be the case if a person who has recently given birth experiences a change in heart rate. How to raise the heart rate? If a person's heart rate is too low or is only low temporarily, treatment may not be necessary. If medication is causing a low heart rate, a person can discuss changing medications with a doctor. A pacemaker may also help a person's body regulate their heart rate in some cases. How to lower the heart rate? If a person's high heart rate is due to stress or exercise, taking steps to reduce this can help lower it. If the high heart rate is due to an underlying cause such as sepsis or hypoxia, treating this will also help regulate the heart rate. At home, a person can also try the Valsalva maneuver, which increases pressure in the chest and can lower the heart rate. The Valsalva maneuver involves a person holding their breath and breathing down. If these measures do not work and a person's heart rate is consistently high, they should contact a doctor.